I think you can get the sense, I'm a real advocate for authenticity and vulnerability and creating spaces where we can say the words death, dying, we can talk about fertility, we can talk about pregnancy loss, but that's my comfort level. That doesn't mean that everybody is comfortable with that. And certainly, as I say, in different contexts, that it's appropriate necessarily to open up that vulnerable space, and some people will feel really overwhelmed to have the tears fall in a public setting. Or so I think you pick your timings. You don't do it in a lunchroom. You don't do it with everyone around. You perhaps take somebody to the side and you offer of, are you okay? Or perhaps, I get the sense that you're not okay. Even acknowledging that can be really helpful. Is it something you want to talk about? Is it something that, can I help you, or can somebody help?
Are there any things that people can do or take with them? Like we talked about already, that checklists are a terrible, terrible idea for those sort of things. But you had mentioned having an ally that goes with you and having a support person when you're going to parties and things. I guess, do you actually need to do like a formal rehearsal and say, how do I do this? How do I work this if something happens?
Sometimes, yeah, a dress rehearsal is helpful. I think setting realistic expectations too. I think we talked about it. Perhaps it's not a year that it's going to be a Merry Christmas, and even acknowledging that early we can see already the songs
That's
are playing.
Such a fair point, yeah.
Yeah, we can see, I think, the lead up to Christmas where already the lights are out, the trees are out, the songs are playing, and that can be so confronting for a really long time. It's not just the day of. But
no, it seems to be getting longer and longer and longer. Really,
and it can be really challenging. So it's almost, I think, taking the pressure off of, you know what, maybe this year isn't a merry season, it's not a Merry Christmas. If it turns out to be merry or has moments of merriment, how delightful, how lovely, because I don't think it has to be one or the other of being grieving or being happy. We're human beings, we're complex, we hold a lot of these things at the same time. But take the pressure off to, maybe there will be a moment, and can I find a moment of peace? Or maybe it just is what it is, and one way or another Christmas will pass. And I'm going to almost ground myself in the present moment of, what am I needing to focus on? What am I doing? How do I get through? Bringing it kind of back to that smaller picture can be helpful when it feels big and it feels like the weight of expectation is on top of you.
Is there an abnormal way to grieve? Like, is there a pathological form of grieving? Like, how do I know if my own grief experience is within a norm or whether I'm falling outside of something? And you talked about before about the models. I think so. How do you know if maybe I'm not right, something's not okay, and I need more support?
Yeah, it's a great question. I think it's generally we would talk about there being no right or wrong way to grieve, as long as you're not causing significant harm to yourself or to somebody else, and the behaviours that you're engaging in. There can be problematic ways of managing your grief that would need to be questioned or addressed. But as long as you're not causing harm, sometimes it's about doing what you need to do to survive, and also it doesn't. Even though grief is normal and healthy and an adaptive response to pain and uncertainty, doesn't mean it's comfortable. So. If it's feeling overwhelming for you, if you're feeling like it's something that you're not able to hold, that you're not able to step out of that grief, from a grief and loss perspective, one of the models we use is the dual process model, which is around there's the grief-oriented side of grief, which is the sitting in the mourning and the being sad, the reflection, the weight of the rubble of your grief experience. And then there's the restoration side of grief, which is kind of attending to normal life, adapting to roles and responsibilities, almost taking a break from grief. And what we know about healthy grieving is that you want to oscillate between the two. The people that get stuck being in the depths of that grief is really problematic, because it impacts your nervous system, it impacts your entire mind, body, environment, everything is impacted. Similarly, if you're only taking a break from your grief and not looking at what's happening, not acknowledging the depth of what has been lost, there can be some avoidance, and that's not necessarily helpful, because another phrase that we would often say is the only cure for grief is to grieve. So you're wanting to go back and forth, and kids do it really beautifully, where it's almost like jumping in and out of puddles of grief. So I guess having a bit of a reflection process for yourself of what is happening. Do I have any space that I can take the mask off that I have to put on every day to work, to parent, to do what I have to do? Am I allowing space to be sad, to acknowledge what has been lost? or am I just running from thing to thing and never acknowledging how painful this process can be?
Is there a time frame that you would say that someone has to complete grieving? Because I think it seems like, memories come back decades, and I don't know that you could ever say, look, after 3 months it'll be okay. No. We talked about losses of relationships. There are lots of fish in the sea, but it's not like that, really,
it's not like
is it?
that. No, it's there's another model which talks about we grow around our grief. So grief doesn't shrink over time, rather our experiences grow around it. So if you consider it to be like this is your ball of grief, in the early days of acute grief, your entire world can be taken up by a grief experience. And again, I'm talking about death-related losses, or certainly fertility, which can be so all-encompassing as an experience that sometimes that's it. That's your world. That's what you have energy to attend to and the emotional capacity to attend to. Over time, even if you have a positive outcome or things move on, that grief is still as significant. What you have been through is just as significant. However, more experiences are added around that. You find a place for that grief. It's more of an integration process than a resolving, which can feel overwhelming for those who are in grief to say, well, what do you mean I'm going to grieve some losses forever? But it's different. Your relationship with that grief changes. So, I mean, yes, there are certain criteria around what we would call prolonged grief disorder. Some people who remain stuck in that acute nature of grief, which is the really early, intense, unable to get a break, really being flooded in your limbic system around grief. There are some things that we would look for from a prolonged period of that's potentially challenging, and we would offer support around. But I'm not a big fan of pathologizing grief. I think it's a human experience, one that when we're supported, we can manage and cope and make space for grief differently. We just happen to exist in a culture that doesn't really do that particularly well. So I think conversations like this are so important to say, we all know loss of some variety. So if we can tap into that to support somebody who's grieving, even if we haven't been through the exact same thing. Because again, even if you've been through fertility treatment doesn't mean you know that person's experience of fertility treatment. So, but we can have empathy around something's been lost here. What is happening?
I happened to have been at a funeral this morning, and it was a very loved person who had passed away, and while there was sadness in the room, there was also a lot of joy and a lot of celebrating of the impact she'd had on everybody around her, and the people who were there, who were not necessarily family, but friends and people who'd come around. And I saw a very positive element of the grieving as part of that. And exactly the same way in fertility, we do see that where you can say to people, look, you have done everything that you can. You can't do more than this. That doesn't take it away. But I guess part of the concern that, particularly in this space, people always have I done everything? Can I do more? Should I be doing more?
And I think as human beings, we have 4 drivers, one of which is a significant need for control. So I think if we're talking about fertility, we have the need for control, the need for attachment, which is around our relationships, the need to increase pleasure and decrease pain, and the need to enhance self-esteem. I think fertility hits on all of those.
I think it does. You're right.
So, one of those being impacted would cause significant distress. So I think it's reasonable to say that this is a really significant process. And also I love what you've talked about, where it's even when there is significant loss, there can be moments of joy or moments of hope or connection, or I think the grief only exists because something mattered. So in the fertility space, it's, well, your want for a child matters. Your want for autonomy over your body matters. All of this is really important, and so the loss is so significant.
It hits so many spaces in this space, doesn't it? Really, it's not just it's not a physical event specifically that's the grieving. It's everything else around it.
Yeah. And I think for some, even the social isolation, that feeling of suddenly being different to your friends or to your family, or not being able to talk to people because they don't understand, for some, that's the most impactful part. And this is where you don't know what it's going to be like. We're sitting with someone and saying, what is it like for you? Can be helpful because it will be different. I can't assume because someone's going through fertility treatment what is going to be most painful, what they've been through, what they will go through, how they're going to respond. It's an individualized process.
And in our daily interactions, are there some things that we can do better, like from professional point of view, are the things that we should be doing better as medical practitioners? There are lots of things that we should always be doing better, but should we be? I always think that just giving someone a website and here, look at that, or some numbers, while that may be helpful, it sort of misses the point a little bit.
Yeah, I think there can be, I mean, I would love to exist in a world where specialised grief practitioners didn't exist. I would love where we could all hold space, but I think because we don't, people like myself do exist. But I think in some ways giving a number or pushing people to a service can feel at times, depending on the person, like a palming off of that support, where giving 5 minutes of, this is really hard, or what is it like hearing that information? There's been, many times that I've walked out of a doctor's office, and at that point I burst into tears, and all it would have taken perhaps is one question in the office to bring that conversation into the room. Acknowledging grief, saying the words death, dying, pregnancy loss, baby death, whatever the words are, doesn't make the pain appear. The person's carrying that anyway. I think we need to get comfortable to say what we're talking about here. I think we've sanitized kind of grief and loss, and we've put it behind closed doors, which adds to this feeling of, well, the person who's experiencing something really significant then feels like it's not safe to share it because we're giving those cues of, I'm not comfortable. So I think one of the simple things, which is not simple in many ways, is we need to get comfortable with our own relationship with mortality, with our own relationship with loss, to have any hope of sitting with someone facing their own.
So is it okay to have someone cry, if you're crying in the specialist office? Is that okay?
I think it would be strange if they didn't.
But no, yes. I agree with you. Look, I think everybody who knows me knows that I've got a box of tissues that's sitting there at all times.
Yeah.
Sometimes it seems like the crying chair, but I think that's part of the journey, isn't it? Really?
Yeah. I think so, and I think feeling safe to cry with someone, that builds trust, that builds connection. I think it's really funny that I'm a grief counsellor, and still many clients will say to me, I'm sorry for crying, or they'll try to shut it away. And to give people, it's incredible.
You just go, this is, you're human. You're experiencing, I would be doing the same if I was in your chair.
And if you can't cry going through one of the most human of experiences, when can you? And I'll often say to people, your tears don't scare me. All of the complexity of emotion, because people don't just show up as sad in response to loss. There's a lot of anger, resentment, frustration, guilt, shame. There's a whole lot of really challenging emotions that we don't sit with well either. But to give space to whatever it is. And as clinicians as well, we are human. We connect with humans. Of course, we have our professional personas on, but at the end of the day, we all know loss in one way or another.
And I think you said that one of the things that you do is you actually do supervision for and grief workshops. And so I think, and you were working that in not only in a medical space, but in fact in non-medical spaces.
Yeah, and allied health, or with anyone working with people, really. I think it's trying to get more and more people comfortable to talk about grief and loss is imperative. I think to be able to talk to people about, well, what is grief? What is loss? What are we talking about? How do you have a conversation? How do you hold that feeling of butterflies within your tummy when you're sitting with someone that's distressed, and lean in instead of pulling away? And how do you take care of yourself in the process is really important, because there can be a toll that it takes to sit in challenging stories day in and day out. We need to nurture ourselves to keep doing this work.
Ali, I have talked your ears off. I'm so sorry. This has just been absolutely fascinating. For everyone who's listening online, how do they find you?
They find me at Grief Guide, so www.griefguide.com.au, and I'm more than happy to have a conversation. So whether it's around someone that you're supporting, whether it's your own experience, reach out. Let's do it a little bit differently.
And of course, Ali has very kindly joined us on the Charlie Network as well. So please log in, come and say hello. Ali, it's been an absolute pleasure. Thank you for talking to us about this.
Thanks for having me.
This will be available online, and we welcome any conversations or comments.
Yeah, please reach out.
Thank you.